So my name's Belinda Henderson and I'm the clinical nurse consultant for infection prevention and control at the PA Hospital in Brisbane, and I've been doing that for about 20 years now. I think I always, and it sounds really cliche, but I always wanted to help people, and that was just something that I always sought, the pathway that I would take. And then I was fascinated with bugs and microbial interests, I suppose. So then I kicked off my career in infectious diseases and then subsequently moved across to infection prevention and control. 7 years ago now, I was actually nominated as President-elect for the Australasian College for Infection Prevention and Control, which is our peer organisation. And I was the President-elect for 2 years, President for 2 years and past President for 2 years, and now sit as part of the board, I suppose, for supporting the new clinicians coming through and really having a voice for infection prevention and control nationally and making that noise around what nurses actually need on the coalface or on the front line. I don't think you can ever prepare for a pandemic, in all honesty. It's given me grey hair, but at the end of the day, it's actually brought infection prevention and control to the forefront of everybody's mind, not only in healthcare and in primary care, but also in the community around social distancing, hand hygiene, not going out when you're sick. So I'm old school nurse, I guess. I've been nursing for a very, very long time. I like a fun environment. I think that's key. You need to have fun when you're at work. You spend more time with your work colleagues than you do with your family. But I think everyone needs to be working towards the same goal, and communication is key. It's positive role modelling. That's all it is. It's monkey see, monkey do. If you engage with someone, doesn't matter whether they do a terrible job or a good job, if you engage with them and take them on the journey with you, then they automatically thrive. At the end of the day, it's about getting on the same page with someone, working towards the same goal and seeing what I can do to assist them, because I can only be in one place at one time. So you need everyone else to be working hard, because infection prevention is everybody's job. Infection control is ever changing. No 2 days are the same. We manage a pandemic one day and tomorrow it'll be a urinary tract infection. It's so much easier when you've got a team that's motivated and driven and very together as a group. So locally, for me and my team, it's about improving patient outcomes, minimising or preventing the spread of infection. And then from that, we feed into the state group, and then we lead that conversation, highlight concerns that we have, request assistance if we need assistance, support our other peer organisations and smaller organisations. And then I sit as a statewide person as part of the infection control network, which is run by medical staff and nursing staff. And then I've got a role that I play nationally with the expert working party for the Australian government. So I think I get to look at it all, and that makes me really lucky. But I think at the end of the day, it is that we need to recognise infection prevention and control as a very important specialty, not just in a pandemic, but at other times, because the work that we do, all of my peers and myself, on a daily basis, keeps our patients safe and keeps our staff safe. And I think to highlight the great work done by my peers in infection prevention and control is why this award, if I was lucky enough to win it, would be fantastic.